In this talk, I'm going to be talking about the nutrition and chronic pain interface and why that is the next frontier. In the year 2023, which is the International Association of Study for Pain's Year of Integrative Pain Care, I feel that nutrition and diet and optimizing that for chronic pain is going to be a fundamental pillar of the whole body approach to pain management. Why do I say that, and what's my sort of background? For many of you who know, I am the author of the Amazon bestseller, The Pain-Free Mindset, wherein I have talked about the importance of integrating diet and nutrition along 6 other important pillars of medication, of interventions, of sleep, of physical activity, of mind and body techniques, and the neuroscience of pain itself. I've also had extra training in sort of functional nutrition for chronic pain, and also done the Winchester University Diploma on Plant-Based Nutrition. And more recently in 2023, I worked with the British Society of Lifestyle Medicine and have released and written the module on pain management and nutrition using a lifestyle medicine-based approach on there. It's all this collective learning over the last 4 or 5 years in terms of a deep dive into the research into nutrition and what the state of evidence is that allows me to draw these conclusions that we can and we should be, as pain clinicians, recommending and talking about nutrition as an important strategy of chronic pain management, and not just restricting ourselves to the drugs or injections or behavioral therapies alone. All of us as clinicians can do certain basic things, and that's what I want you to take away from this lecture today. So part of this lecture is initially going to say, well, what do we know about the microbiome? You know, that wonderful collection of microorganisms that's there in our gut, right from our mouth to our back passage, and what its role is. And the second part is, how are you going to assess and manage, and a bit about the implementation of any of this, whether you are a healthcare professional listening to this or whether you're a patient looking to see what it is. First of all, let me start by saying this immortal line from what John Cryan, professor from Limerick in Ireland, said. And he said, whatever happens in the vagus doesn't stay there. There's a play on it, but what actually he was trying to say is that we need to think about one of the fundamental links of where the vagus nerve is the longest nerve in our body. It's called the 10th cranial nerve, and it brings a whole lot of information from the gut back to the brain. And therefore, understanding the gut, the microbiome, the component of the microbiome, which is the microbiota, and more importantly, the concept of what's called the hologenome, what does it mean? And a little bit about the axis, what's the brain-gut endocrine axis that everybody in health talks about, and how is that related to pain? And more importantly, we now understand that the gut is like your second brain. So you've got the vagus nerve connecting your first and your second brain, and that means we have opportunities. Well, it all goes back to the early 90s, at the time when we were thinking about the Human Genome Project. The American president at that time was quite keen, and the data from science and biology was this eternal, boundless optimism that if you could somehow sequence all the genes, every disease would be mapped to its genes, we'd know what to do to the genes, and every disease would be sorted, and healthcare will be wonderful by the time we come into the 2010s. Well, if we're here in the 2020s, and they realized that with the Human Genome Project, you really could not get any valuable information. In fact, they got some valuable information. They found out that plants, like the maize plant or even the sort of grape, has got 25,000-30,000 genes, whereas the human had only about 23,000 genes. So that means that we humans have less genes than plants, yet we are this superorganism that we are. How is that possible? What is it about us that makes us different? And really, it's not about us, it's actually what's within us that's making the difference. That's what led people to think about the next step and the funding for the Human Microbiome Project, where they realized that actually they've got to study the microbiome in greater detail. And by sequencing the genes of all the other microorganisms that live in and around us, we now have found out there are almost 2 to 20 million genes that come from those microbiota, and they are actually interfacing and constantly talking and modifying and changing the 23,000 genes and the material and the proteins that we make. And we find out now that we are only about 40 to 50% human. It's changed a bit, which means that only 50% of the cells right now that we have, that I have while I'm talking to you, is human. The other 40 to 50% are likely to be from the microorganisms that live within and outside us. And that means that this whole composite set is doing something which we are only now trying to figure out. Well, the question is, what are they trying to do? And actually, the data and the research now establishes that we know that the gut is the second brain, no doubt about it, but it also means that most of the serotonin, maybe up to 90% in some studies, and definitely up to 50% of the dopamine, actually gets produced in and around the gut before being taken into your brain. So your mood chemical, which is serotonin, and your drive chemical, which is dopamine, comes from actually the gut. And it is a huge organ by itself. If you take out your intestine and you kind of lay it out, its senses, so it's the largest sensory organ, bigger than your skin, but if you lay it out flat, it's actually the size of a basketball court. Imagine that, a size of a basketball court. That is the size of what you're looking at when you spread out your intestine on that nature and scale. Well, two questions. Why and how is the gut able to do this? Well, effectively, the gut is able to do it because it has got so many microorganisms right from the mouth to the back passage. The total weight itself is heavier than the brain, sometimes 2 to 6 pounds, as they said. So that's heavier than the brain itself. So that's the content of it. And if you take all the genes of that the microorganisms have, combine it with the 23,000 genes that we have, that's what we call as the hologenome. And it means that these genes are constantly interacting with each other, changing each other as the time and the days and the years go by and we grow. All that has an impact quite generally. We have to ask, well, why? What is it that the microbiota do? First of all, they reduce any harmful other bacteria or microorganisms. So they have a bit of a crowd control and policing within themselves. So there is a bit of equilibrium between the good and the not so good microorganisms. They therefore help in keeping the equilibrium in that local area and prevent it from getting too bad. The intestine doesn't become too acidic or too alkali or too much of anything. But they also then facilitate the fermentation of some of the fiber-like foods that we have. Indeed, the reason everybody tells us to eat more fiber is because fiber actually feeds these microorganisms, especially in the large intestine. And they might actually be changing some of the drugs that we have, which might be a reason for explaining why some antibiotics work well in some people while others don't. Some drugs work well in one person and others don't. And in fact, within the same person itself, sometimes the antibiotics are super effective. Other times we think tolerance has happened. We somehow used to think that this was all with the receptors. But now there's a thought saying that, well, could it be that it is being influenced by the microbiome itself? And that means that these microorganisms, they release chemicals that have this kind of talk with our immune cells, because our immune cells are also maximally present in the gut. It makes sense. You would want to have your police to be close to where the border is, where there's the highest chance of any kind of wrong entry. And the gut essentially is just a single cell that's separating our immune system with the microorganisms on the other side of the cell. And that means there's this constant language going on between and across these cells, which is very important because that has a role to play. It has a role to play not just at any time in adulthood, it might indeed have a role to play right from birth when our nervous system is forming and we are growing up as children. What we eat, what kind of breastfeeding we have, what kind of baby food we have will all influence how and what kind of microbiome we are actually born with or given with. Because there's a difference. When you're born vaginally, you have a different introduction to a microbiome. If you're born by a C-section, cesarean section, you might not have some components which people think are quite useful. Indeed, in some maternity units, it's a practice to actually take a swipe of the mother's vaginal microbiome and smear it all over a baby's face if the baby is delivered by cesarean section, just to populate the microbiome in the first instance. And indeed, we've got studies now that say that if you have mice who have no microbiome at all, what's called the germ-free mice, they actually have less pain sensitivity. They also have some changes in the brain, which means they have less memory. So that means there is some role that the microbiota and the genes are playing in how our own genes are expressed. The epigenetics are changed. You can see what all this means in terms of what to do about the microbiome, how to keep it nourished in a good supply and a balance. That has a role in chronic pain as well, because if you are going to start with the concept of dysbiosis, meaning that balance, that homeostasis is lost. That's called dysbiosis. The microbiome changes. It does not stay the same. The equilibrium and the balance between the good and the not so good microorganisms tilts in the favor of the bad, let's say. And that means that dysbiosis will be changing the diversity of the microbiota, will make the functioning of the cells and the immune system a little bit different and unusual and impaired. And that means that the intrinsic immune system itself starts to malfunction and starts to feel sensitized or inflamed. When the immune system in the gut starts to do that, it leads to a breakdown sometimes of the cell functions at the lining. And actually what it means is that it will start to throw out more inflammatory chemicals. If you are someone who has got what's called the visceral fat, meaning you've got more fat around your intestines, we know that's the wrong kind of fat, and it is the wrong kind of fat because those particular cells in that fat release these chemicals called adipokines, which are also going to release inflammatory chemicals on there. The leaky gut concept is something that was not very familiar and not very mainstream about 6 or 8 years ago when I started reading this information. But now we are beginning to accept and understand that leaky gut is a very viable and very likely concept when the cell breaks down. Effectively, if you think about it, you have this mucus layer on top of a single cell, and at the bottom of the cell, as you can see in the slide, in the lower area is your immune system with all the complexes. And the upper part there is your mucus layer where all the microorganisms live. When you have, for example, drugs like opioids or long-term use of non-steroidals or even some stomach protecting agents, in some cases, they can actually break down the mucus layer. And as the mucus layer gets lost, the cells are not protected anymore. The microorganisms, especially the bad ones, can release chemicals that cause a bit of inflammation in the cells, causes the cells to separate out, and that's what is called as leaky gut. When those are separated out, the chemicals get direct access to the immune system. They then get the immune system all sensitized, and that can be the start of problems. Well, what does that mean in chronic pain world? It means that when you do have, for example, ultra-processed foods, some ultra-processed foods, when you do have high fatty foods, when you do have the bad kind of fats or lots of carbs, it's going to sensitize the immune system much more. That sensitivity is going to go via the vagus nerve, into your brain, and that is going to cause further inflammation and changes in various functioning within the cells of the nervous system, including the brain. All of this changes how the immune system in the brain also changes. This combination of changes that happen in the nervous and immune system in the brain and the spinal cord is what's called central sensitization. That's quite important because we now realize that as far as nutrition and chronic pain goes, both being underweight or obese are both issues. It's not that a thin person necessarily can't feel chronic pain, but it means that going for example, weight loss surgery, and maybe some of you are aware that having a weight loss surgery and necessarily trying to address obesity does not sometimes change the pain at all. Indeed, in most cases, the intensity of pain stays the same. That means we realize that both being underweight and obese is a challenge. It also means that most people with chronic pain, you can't think about nutrition as an option because chronic pain does not occur alone. Up to 60% have got other long-term conditions. Indeed, diabetes and cardiovascular disease are 2 times more common in chronic pain. And we know that in other long-term conditions, you have this component of what's called inflammation due to a variety of other structures. So the systemic inflammation is now seen in all long-term conditions, including chronic pain, and that's because the immune system gets sensitized, which is something we can potentially change with nutrition. All in all, we also know that when people are in pain, there are certain behaviors that will change. You may not want to eat. You may want to eat just comfort food. You may not want to eat with others, so isolation plays a part. You may just want to rest a lot more, so you get more sedentary. So those are all behaviors which then causes deconditioning and can worsen the pain. Indeed, there are some studies that have now come out where they have looked at the kind of studies and the variety of diets being looked at. And what we now understand is that the main problem that happens when your diet is poor is you actually have inflammation and you have what's called oxidative stress. So within the cells, the energy factory production capacity changes, they get more inflamed, they don't do a right job of utilizing the energy or putting out the energy because those structures are not performing well. I have to accept that these studies are all small, there's a lot of bias, but that's the general indication of all these studies. Indeed, one better study that came out last year from this group in Australia, and they have actually done a much better job of bringing together and looking at all the data. And they have actually done even what's called as the gold standard in nutrition, a randomized controlled trial with chronic pain as a possible reduction. And what they were able to show is that if you can just get people in groups and talk about nutrition, you can promote it, and that way people can have less pain interference, they can have improved pain efficacy, they feel more in confidence of looking after themselves. There are some challenges that they couldn't get all these patients to keep coming back. So there is something to be done in the research in terms of understanding how to make people stick with it there. But it's already showing that where it helps and people are motivated, nutrition does not have any adverse effects like drugs or surgeries or injection, and it can give an equal amount of relief. Indeed, that's what we say, that if you can optimize for nutrition, you are going to make a whole person better, and that is the whole body approach to pain management. So how do you assess and how do you manage? As a pain physician working in a district general hospital in the United Kingdom, I think what I'm doing right now, what we talk to our patients, can be done by anybody in primary care, anybody in secondary care, not just in the United Kingdom, but anywhere over the world. These are simple, easy to do recommendations, which will be all safe. Yes, some patients may be complex and will require a nutrition or dietitian, But we as a physician, healthcare community of a variety, whether it's physios or psychologists or nurses or any other GPs, primary care physicians, specialists, we should be able to have simple talks there. One is we should be able to do a good dietary assessment and then give them the basic information of improving the dietary quality. That can be simple as trying to align with national guidelines. Now, I know that national guidelines also are not perfect, but at least that's a starting point for chronic pain. You can give them the simple information of increasing the fruit and veg consumption because they are rich in what's called phytonutrients that will reduce inflammation. So there is good evidence to say that. We can ask them all to increase the omega-3, the monounsaturated acids, and reduce the polyunsaturated fatty acids. We can increase and ask for hydration and try to reduce the amount of ultra-processed or processed food in general. Again, we know how cheap and economical processed food is, and that might be a good argument in people during the cost of living or who are economically challenged. But there is a role for reducing some of the processed food where possible and trying to cut out some of the ultra processed food, absolutely. And reducing alcohol and coffee does go with that, even if it's difficult to do around the time of Christmas. There is going to be some guidelines, and I will link this literature review up in the video for you to have a look. It was a very good study done by this group in 2022, and they give a series of simple recommendations that any pain clinic or primary care or a GP or a physician or a clinician looking after patients with chronic pain and considering diet or dietary interventions. These are simple things to do to try to do the basics that I spoke about on the previous slide. So what's the top tips that I talk about in my clinic and what I think you can focus on? One is, of course, reducing the processed food. The second is increasing your anti-inflammatory foods, as it were, ensuring hydration is adequate, considering supplements where appropriate, but more importantly, the concept of what's called intermittent fasting. What do I mean by all of these things? Let's take reducing pro-inflammatory. A simple rule of thumb to go for is to look at the GI, the glycemic index, which essentially is the amount of sugar that gets released when you take a particular food. So any food can result in a release in certain amount of glucose, and that's what the index measures. It's just a unitless number from 0 to 100, and there are websites that give you the GI index of many foods. I'll link to one such in the video link there. But one particular point to remember is the normal usual GI index, for example, of sugar is 62. And what we want is that anything less than 55 means it's a low glycemic index, so that's good. Anything above 65 is not recommended because it has got a high GI and it will result in a big amount of sugar, and that can be pro-inflammatory. Imagine we need to be only taking 6 to 8 teaspoons of sugar a day. That is all we require. But if we have one bottle of the soft drinks in the market there, that can be as much as 17 to 20 spoons of sugar. So just one carbonated soft drink on the market can do that. Please think about that in terms of your sugar content per day. And all we are asking for, all I ask my patients is, see if you can reduce that by 10% as a starting point. We know that sugar can be very addictive, so I'm not asking for anything significant like a total cutout. Bull on you if you can do that, but just 10% reduction. Increasing the anti-inflammatory foods. Most importantly, in terms of some of the foods, processing of foods we know is useful, but by general terms, when you process something, you're going to make it more inflammatory. So that is what you want to try, increasing the anti-inflammatory. One of the things we do is, for example, omega-3 is a kind of fatty acid. That's good. And normally, before the processed foods came along, the ratio between the omega-3 to omega-6 was 1:1. But now omega-6 is pro-inflammatory, and when you have processed foods, the amount of omega-6 goes up to almost as much as 1:25, and that can sometimes be a problem in some patients. We've got these issues of people now becoming more gluten or lactose intolerance. We have challenges with high fructose corn syrup and indeed some carbonated or fizzy polyamines. I'm not going to go deep into that, but these are all various versions of foods that are actually inflammatory and the diet that has changed over time. One of the things I often recommend my patients to consider, just to get an idea of how many teaspoons of sugar, is this particular GP, David Unwin's infographics, which has been approved by even the main organizations in the UK. And I would urge, and we'll leave a link for that in the video for you to check out. And that would be a good place to start. It's easy, you can print it out at home, in your practice, in your clinic, just to give patients and you an indication of what foods have how much of sugars in them. Simple teaspoon-like sugar visuals, so they're quite simple for everyone to understand. Another thing that we talk about is the link between obesity and pain. Often we've thought that being fat brings about a mechanical load. But we realize it's not just about being fat, it's about the fact that some kinds of fat, the ones that are there on the inside, even people who are thin on the outside but are fat on the inside, what are called the TOFI, where they have fat around the intestines, that produces a lot more inflammatory chemicals, and that doesn't necessarily change when you have a bariatric surgery. In fact, that's why people may be left with the same intensity of pain even when they have undergone weight loss, either naturally or surgically. One of the big things we're starting to realize now is this role of the microglia. We realize that these are the cells that are the immune representatives within the brain, and we realize that they can get inflamed because they have got all these cameras which are looking out for threat or stress. If you are feeling particularly stressed or threatened, they can actually release chemicals. And the challenge is that their cameras are not going to look out just for the threat that comes from the outside. It means that when you have foods that are inflammatory, like we spoke about, sometimes processed foods, anything with a glycemic index above 65, those inflammatory chemicals are still enough to activate these microglia. And that means that they start to change shape, they get bigger, they become more inflammatory, and they start to throw out lots of other chemicals that actually cause damage. And that is something we realize can happen due to the kind of food that we eat and how it affects our immune system and our nervous system, especially in the brain and the spinal cord. That's where there is a lot more interest now in seeing how you can do something about protecting the microbiota, protecting the gut bacteria, maybe repopulating it with bacteria. One of the popular ways is probiotics. But probiotics only contain a limited number of bacteria that are actually capable of being synthesized in aerobic or in environments where oxygen is present. But a lot of the gut bacteria which live in the large intestine are anaerobic, which means that they don't need oxygen to survive, but actually they may die in the presence of oxygen. So it's been difficult to actually make an industrial level quantity of trying to replenish those bacteria. What we then do instead is actually prebiotics, meaning that fermented foods like kimchi, sauerkraut, yogurt, these are all, and even fiber sometimes, these are all foods that are capable of repopulating and feeding the larger bacteria and the microorganisms in the large intestine. There are certain ones which are creating more research in there, like this Akkermansia, but I think this is all research that is emerging. Similarly, when it comes to supplements, we talk about that. I talk about hydration as 1.5 to 2 liters a day at the minimum, as long as you have no other health conditions. But supplements, there is a lot of talk in all of these supplements that you see listed on this page, whether they are vitamins like A, C, or E, whether they are going to be any other kind of calcium or magnesium or iron or nickel or turmeric. There's a lot of these that can be tried. There's some evidence that it works for some people with chronic pain, other times not. It's difficult to be precise as to when it's going to always work, but these are all safe. They have a good margin of error, and I would definitely suggest that these be looked at as part of your whole body approach. The last bit which I want to focus on and talk about is this concept of intermittent fasting. Now, that's not something we usually talk about, but I think it is something we need to become more aware, and that it is slightly different from the fasting that many religions practice. And actually it makes sense now as to why every religion has some kind of fasting schedule tied in with some religious event during some part of the year. It makes sense to do that kind of big ones, but the intermittent fasting that in the last 10 years has been discovered through science and the understanding of what it means is essentially, can you give a period of undisturbed time where the microorganisms within the gut, the microbiota, and our own body and immune system do a bit of a self-clean wipe-up job, a janitor's job that it can achieve. It can do it. It's been able to do it for millennia before drugs came along. All we need to do is just give the time. Because what we've done is, as opposed to our ancestors or even our forefathers or grandfathers who might have had their dinner at 6 or 7 in the evening and had gone to sleep and then eat their breakfast next day at 8 or 9 or 10, where they give that natural 12 to 14 hours. Now, because of lighting, because of eating late, because of working late, we keep eating right up till bedtime, about 10, 11, midnight. And then again, we start eating breakfast right in the morning. So we don't give any time for the gut to actually do a bit of a cleanup job. So all I ask my patients, and in terms of pain, it becomes very important because giving that time means that the body is able to take out some of the inflammatory foods and chemicals already just by giving 10 to 12 hours. So starting with a simple way of eating your dinner a little early and pushing your breakfast out a bit longer in the morning is enough to achieve that. Just 12 hours with sleep in between can be a good start if possible. And the way I think about it is like a hotel. You do want a checkout time and you do have a check-in time, which they at least ask for 2 or 3 hours for the staff to do their job. All the body needs is 10 to 12 hours. Not 3 hours, unfortunately, but 10 to 12 hours at the minimum, 14 to 16 hours if possible. What it actually means is that during that period of 14 to 16 hours, it's not that you have to be fully fasted. You could still have things like water or even sometimes tea, maybe even a dash of black coffee. But what we don't want is something like milk or a heavy food or something processed in the morning or late at night. That is what is being requested. And actually, as I said, 12 hours, the aim is if can you reach 16 or 18 hours, but a minimum start is 12. And if you can actually do it with friends or your family or your partner and hold some accountability, then I think it becomes much more easier to do. And that doesn't have to be just for pain control. It does improve a lot of other health parameters as well. Ultimately, what I tell about an anti-inflammatory diet, both in my book and clinically as well, is that there are going to be so many diets that I've talked about in my other videos. The aim is that we just want to reduce the amount of ultra-processed, increase the amount of anti-inflammatory foods, and ensure that we want to stick with predominantly a whole food, predominantly plant-based diet. And that's all we are aiming for. That's where the best health is. Yes, we talk about the Mediterranean or the low carb, but all I'm going to stick for is if you can get a few basic principles in place and try to keep what I call the 3 C's. Get the cuisine culturally congruent. It's difficult to expect a Mediterranean diet to be suitable for someone from South Asia or from the Caribbean. So it's important to get culturally contextual specific cuisine. And it's possible to do that if you stick with the basic principles that I've talked about in terms of hydration, fasting, reduction of certain foods, increasing of other foods. And how you implement it often becomes key. Because, for example, we talk about the fact that are people ready to change? If you are a patient listening to this, do you find that nutrition is an important aspect and you want to include it? If you are a clinician listening to this, are you ready to talk about this and feel motivated to learn a bit more? Go onto my website and read my book. There are some resources there. But fundamentally, we need to realize that if we are a healthcare professional looking after our patients, sometimes we need to find out, are they ready for change? They may not even be thinking about nutrition when they come into your clinic. That may be all you need to do in the time when they are pre-contemplating, is to give them some resources, give them some videos, show them some books, give them the reading material if they are not aware. But if they are ready to take action, if they want to do something, that's where you can probably get the advice that I've given you today, give it to them as basic starting. They may want some hand-holding and support. That's where you may need to get a dietitian involved to give a little bit more of a personalized approach. But that is where the magic happens. If you can get the understanding, a curated plan, they have somebody to hold them accountable, that's where the maintenance and sustainability comes through. Like anything with pain and nutrition, sometimes you can fall off the wagon, but the ability should be there to come back in a cycle. I use the framework of the theories of stages of change, which is what I've shown here. And I don't by any measure say that eating an anti-inflammatory diet and nutrition is going to be easy when it comes to pain. But the aim is, if you're ready for change, it is truly the next frontier. It can be a game changer. It does not have the side effects and the problems that other therapies for pain has. And it's possible to do it with family safely, effectively, and for a long time. Thank you for listening to this video. I hope you enjoyed this content. Look forward to your comments on this. Please subscribe to my channel and I'll see you in the next video.